You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode I spoke with Dr. Stacie Boswell about cold weather veterinary care. Dr. Boswell is based in Montana, so she is very familiar with harsh winters and the challenges associated with them. The Disease Du Jour podcast is brought to you by Merck Animal Health. Dr. Boswell graduated from the Virginia-Maryland College of Veterinary Medicine and completed an internship at North Carolina State University. From there, she was a postdoctoral research associate in the Comparative Orthopedic Laboratory at Cornell University, and then completed a large animal surgery residency at the University of Tennessee. The intense specialty training in surgery and equine lameness evaluation and treatment culminated in qualifying for and passing a rigorous examination from the American College of Veterinary Surgeons, thus earning diplomate status as a large animal surgeon. Dr. Boswell is driven to make horses' lives better through both physical and mental well-being, and she has a strong interest in equine behavior. Working with patients in a low-stress way led Dr. Boswell to be a collaborative author for Equine Fear-Free modules. Dr. Boswell is also the author of The Ultimate Guide for Horses in Need, Care, Training, and Rehabilitation for Rescues, Purchases, and Adoptions, published by Horse and Rider Books. Welcome back to the podcast, Dr. Boswell.
Thank you for having me, Carly. I really appreciate it. I'm looking forward to talking about cold weather today.
Yeah, I'm so excited to have you back on. For anyone who missed the first episode, we talked about fear-free veterinary care, which was a really great topic. Shifting focus a little bit in this episode, can you get us started by maybe giving us a little bit of an overview about how significantly winter impacts your day-to-day work as a veterinarian?
Yeah, so I think it affects a couple of things. It affects the speed at which I can do things, because if it's super wet or super windy or super cold, that kind of slows us down. The work is not easy. And if the roads are bad, it might take us a while to get somewhere that we could normally just zip right over to. So it definitely slows me down. And then I think the other thing is it impacts the types of cases that I see. So, in the summer when lots of people are riding, we might see orthopedic injuries that are like wear and tear or usage injuries. Whereas in the winter, a lot of horses don't get used, or at least not used as much. And so we might not see that, but we might see more colics and more like slip and fall on the ice type of injuries. And for sure, just fewer, like a lower caseload in general in the winter. And I think that's universal among equine vets, is that winter is a slowdown period.
Yeah, that's such a great point. I guess from a scheduling perspective, are there certain procedures that you try to get done before winter starts, either because they're not practical to do in cold weather or just to make your life a little bit easier once the cold arrives?
I think it's a really interesting topic, because it seems like there's a cohort of veterinarians that don't want to do dentals in the winter, which I kind of don't either when it's very wet. But in my area, in my valley, there's 3 different practices that tried to financially combat the winter slowdown by offering a winter float special in November, which November can be pretty mild or November can be terrible. And so I do a lot of floats in November every year, but I do have a haul-in facility, and that obviously makes a huge difference. Definitely the other topic that I've talked with other vets about is castrations. So if we're laying our castrations down, there's a place where each of us is a little less comfortable when it gets too cold. And I do think that some of that depends on where we are, what facility we're at, and what the horse's physiology is. So I might be more inclined to do a little bit more with a horse that's born and bred in Montana and has a good winter coat versus a horse that is body clipped or moved up here from a warmer state. That might give me pause for doing a castration. So I think there's a high variability, but there is definitely, like, some of those convenience procedures like dentals, certainly easy to do those in the warmer weather.
Yeah, that's great advice. And so true that horses respond so differently based on where they're raised and what they're used to. If they're born in a cold climate, winter's like no big deal for so many of them, versus if they come up from Florida or somewhere warmer. So I know we touched on this a little bit earlier, but what are some of the most common health issues you encounter during cold weather? And what are some of the most common emergencies that you respond to during the winter?
I mean, by far and away, the two big ones are catastrophic slips and falls on ice and colics, and more colics, and more colics. So there's, especially through the change in the fall, when horses stop eating grass and they start eating hay, and when the water starts getting cold at night with the drop in temperatures, and then horses are warm during the day, but they've started to put on their winter coat because the day length has changed. That's when I see probably the most colics, is through that like late fall season as horses are getting adjusted. And there's just multiple factors that lead to that. Their winter coat is on and they're sweating and losing electrolytes during the day, and then they don't drink enough because we haven't quite yet put the stock tank heaters in the fall. So that is by far and away the biggest thing, is the colics.
Yeah, it's definitely scary this time of year. And I imagine you have to do quite a bit of work to educate owners on how they can reduce their horse's risk because, that is such a huge concern once the weather starts to change and fluctuate.
I do think people here are pretty proactive with stock tank heaters, but I do feel like through that fall season, I have that conversation a lot. Well, if you're worried about colic today, make sure you get that stock tank heater in if you haven't done it yet. So for sure, lots of conversation.
Right. So a big topic leading into winter is always senior horses and how we can support them during the winter. I think it's often hardest on them. So how do you address client concerns about their senior? How do you support these horses? And do you ever have clients coming to you worried that their horse might not make it through the winter and wondering what they should do proactively?
For sure. This is the senior horses, really, they do struggle the most. The first year that I was here, I came up and started work in January. And then, I was just building the practice. So I wasn't seeing as many horses as I do now, but I was seeing a few. And there was this little flurry of snow in mid-October. And then in the next 2 days, I euthanized 4 horses. And I was like, oh my gosh, what just happened? And I see that every year here. People, that's one of the ways they sort of prepare, is they have gifted this horse an extra summer. They've kind of let it go through the summer, but the last winter was really hard and they're just not willing to do that again. So that's one conversation that I think is a very important proactive conversation to have. In my world, I am totally fine with that approach. I definitely do not want to be down with a down horse in 4 feet of snow at 2 a.m. in the morning when it's 20 below. Like, that is just not ideal. So having the conversation about euthanasia sooner rather than later. I'm also very proactive about body condition score. So if they are at a healthy weight, a body condition score 5, they're probably going to do okay. But I do kind of like doing the dentals in the fall, because then I know what they have for teeth when they are not going to be eating as much grass and they're going to start eating hay. Like, are those teeth able to chew hay? Do we need to modify their diet? Let's make sure, it's August right now, September. Let's make sure we really help this horse pack on some pounds before winter. Because if we don't get ahead of it before the weather gets really cold in December and January, this horse is going to struggle. And then the third thing is to talk about mobility. So if a horse has, been retired and it's pasture sound, so to speak, or it's got some issues and it's not rideable and it's out, living its life in a field, wanting to make sure that we give it maybe an equiox daily, or maybe we make sure that this horse, if he's losing range of motion in their knees and their carpal joints, what does that look like? Because you might be able to get around in the field fine during the summer if the knees don't bend too well, but it might be a lot harder in the snow. So how do we make sure that this horse is comfortable? So those 3 things, just addressing when end of life should be, and just making sure owners understand what that can look like, making sure these horses have a healthy weight by modifying their diet, and then making sure we're addressing their mobility issues with, joint supplements, or however we're going to address with pain medications, making sure that they are as comfortable and moving as well as possible before we get into the winter.
Yeah, such great points. And do you find that seniors are more prone to winter colics? Is that Is that more of a concern in that age group, or is it more spread across various age groups?
Well, I feel like it's more winter associated. However, horses that do not chew their roughage adequately are more prone to colic in general. So there is a Venn diagram overlap there for sure. But I feel like when I see these like late fall colics where the horse hasn't, he's lost some sweat and he's not drinking enough, I feel like that's pretty applicable to all age groups.
Okay, yeah, makes sense. Today's Disease Du Jour podcast is brought to you by Merck Animal Health's Prestige Equirab vaccine. Prestige Equirab is the only monovalent rabies vaccine specifically designed for horses. Equirab is trusted by veterinarians for its safety and long-lasting protection. One smooth, low-volume 1 milliliter dose elicits a 14-month duration of immunity. Learn more at mercanimalhealthusa.com. So then on the other end of the spectrum, and maybe a little bit less common, but what happens if you have a mare who foals during the winter? How do you support those foals and keep them warm, especially if they come like in the middle of a cold spell or a winter storm? Mares often love to foal during storms. So do you have any advice for vets who might be seeing those cases?
Mares are the best at making sure we get our full workout in the winter, for sure. I think a lot of people in my region strategize, like the ranch horses and the horses that people are breeding to keep themselves. We're just not making horses that are born in January and February. It's hard to do anyway because the mares don't start coming into heat very early if it's a cold winter. So, and I know it's supposed to be light related, but I swear in Montana, they come into heat later because they're just cold. If it's a bad winter, it's tough. But the ones that are born sooner that people are really working towards, 100% need to have some kind of shelter. We need to be watching the mares really closely. So let's say you have 2 stalls and 6 mares, let's make absolutely sure we're really putting our hands on those mares and we know them really well every single day so that we can make sure that we have them in when they're going to foal. And I like to really make sure the mares come into that stall, they're comfortable in that stall. They've been in there enough that they are going to be able to relax and not have any trouble. And then once the foal is born, as long as they have a way to get dry, so getting dried off is important, and they have a windbreak, they usually do pretty good. There's all kinds of foal blankets out there, but I find that a human vest actually works really well. You can just put it over their little front legs and zip up the back, just put the front over their top, and it works really nicely and is about the right size. So making sure they have a way to stay warm is important. I do want to issue a word of caution as far as putting heaters in barns. Those are a huge source of barn fires. So you want to make sure that everything is set up to code. My house is an apartment above a barn, and we have sprinklers installed in both our upper and lower levels. So I think making sure you're really proactive if you are going to use a heat source, that it's absolutely as safe as possible is extremely important.
Yeah, that's so important. That's always my biggest concern going into winter when the horses are in more and the barn's more closed up. And I've never heard about using a vest for a foal. That's really interesting as well. I've seen lots of people use dog blankets on foals, actually.
Oh, sure. Yeah, the dog blankets would be about the right size.
So I guess shifting focus a little bit away from health concerns, but what are some challenges that you might face as an ambulatory vet during the winter? Maybe conditions like, bad roads, freezing medications, keeping warm. Do you have any general advice for ambulatory vets on that?
Yes, stay warm. Taking lots of layers so that if one of your layers gets, damp, you can change that out is helpful in general. I don't find that the weather has ever made it impossible for me to go somewhere on an out call, but I'm in a state where the state has invested in snow plows. And so I know the roads are going to get plowed. There's going to be material put down on them, and everybody makes sure in the winter we have our snow tires on. If you're in a state that's, a little more southern, they might not have invested in the snow plows because they need the funding for other things. And so that infrastructure can really make a difference. So if, let's say, Alabama got a freak snowstorm, it might be more challenging because you might not have snow tires on your truck, most likely, right? And the state isn't plowing and certainly can't get to all the roads at once. And so I think for the northern states, we're really kind of prepared every year because every winter could be a bad winter. So just as far as getting to calls, that's sort of my best strategy. And I am going to go see a colic. I have a few extra bonus items that do really help me. I will leave my truck running while I'm there, and I will put my nasogastric tube over the dash where the defrost is. And then it's nice and warm. I'll take it from that spot. I'll put it in my shirt or vest. I'll go over to the horse and I'll tube him right away. So that tube is nice and warm and hasn't been out freezing. I also have a bucket heater. So somebody could get me a bucket of cold water, and I have a little plug-in heater that will boil that really quickly. It sounds like I've talked to some people recently who have also put an electric kettle in their vet truck. So you can just quickly, like they very rapidly boil water. So you could quickly boil some up. Honestly, everybody is going to have a stock tank heater. So most of the time, if we just dip water out of their water trough to use for things, that works really well because it's already sort of pre-warmed. I will take a little tote of medications, and instead of having it like in the back of the vet box, I might put it in the front of the truck with me. I might drop my Banamine and my xylazine in the truck and then put a cap on it, but not a needle on it, just a dosing cap, and then put the needle on at the last minute because that's where the drugs will freeze, is for sure in the needle first. And then I'll keep that in my pocket or in my hand or in my shirt, and then I'll go straight over to the horse and give it right away. And that usually works really well. Our trucks at my practice are kept indoors in a heated garage during the winter. And we're pretty careful if it's cold during the day, but we have to use the inside of the hospital. We might back the trucks out, work on a horse, and then we'll pull the trucks right back in. So it's usually very workable, even during significant cold snaps. I find that in the winter, the thing that challenges me more than the cold is the darkness. The day lengths are really short, and obviously the further north you go, the more that is a thing. And so when I go somewhere, I want to make sure that I have a headlamp, or I know that I might be working in the truck headlights or something like that. So if people have extension cords or they have lights already set up, that works great. I've definitely looked at horses in a few garages because there's light and electricity in the garage, but not out in the run-in shed. So people can be really, creative about making sure we have that. But having the light, I think, is more of a challenge with lacerations and things like that.
Yeah, that's interesting about the garage. I imagine some people have to get a little bit creative if they don't have a barn, and it might be a little challenging for the vet to go out and treat the horse in the field when there's a foot of snow on the ground and it's dark. And so it's interesting the solutions that people can come up with as needed.
For sure.
So you also have your own facility. Do you run into any challenges there, maybe with people being unable to haul their horses to the clinic if there's snow on the road, or any other winter-related challenges with the clinic?
Yes. So we do have like automatic heated waterers that are in our outside runs, but we honestly don't use them in the winter because inevitably one of them will freeze and then it'll thaw out and it'll overflow. And so we just kind of go to heated buckets in the winter. We're really careful about making sure the footing is good. So we have a maintenance person that makes sure they plow paths just for the people going back and forth between the buildings, also making sure that there's plenty of either salt down to help keep areas thawed, or putting down some sand or gravel so that horses can load and unload in our parking lot. If I need to do a lameness exam, and the area that I usually use is iced over, like I usually use my parking lot. And if it's pretty icy, sometimes I'll just have people meet me at another indoor arena, and we'll just pay the haul-in fee and go look at the horse over there. That works really well. I think it's safer to take the vet truck out than to haul a horse and trailer in, but I've had some really tough Montana people that it might have taken them 2 hours to get there, but they have dug their trailer out, got their horse in it, and made it here safely. So I always tell people with horses, I know that it can be stressful, especially if you have an emergency, but like, take your time, drive really safely. We're not going to be stressed out if if it takes you 20 extra minutes to get here. We'd rather you just get here safely. So when I have scheduled appointments, I'm really careful to make sure people know if they're bringing me a horse, just take their time. I understand how that can go on the other end. And so we'll just work it out and it's fine.
Right. So much better to be safe than to get into an accident on the way there while you're hauling livestock. That can be a little bit challenging.
Way
So,
more challenging than just driving slow to begin with.
yeah, definitely. So I think we've touched on this a little bit throughout the episode, but do you have any important topics that you believe vets should educate their clients about to help keep their horses healthy and safe during the winter?
I do. The old horse thing, it really bothers me when I see those horses that are underweight and people's belief is because it's just old. I have a very strong opinion that these horses should be able to maintain a body condition score of 4 or more. And if they can't, we need to change the food or euthanize the horse. But those horses that are too thin, it's really important that veterinarians sort of combat that myth and try to get people to be more proactive about either feeding them differently, whether that means we go to all pelleted feed and we're adding oil or whatever that looks like, or we euthanize those horses, because I think those horses really suffer. They suffer a little bit during the summer, but they suffer a lot in the winter. They can't maintain their body heat. They might need a blanket. So those are the ones that I really, really want to do the most education on. And then colic. I feel like as a vet, we talk about colic a lot, but then I'll have somebody who is new to horses and they don't really know anything about colic. So it's important that we do continue that conversation. And if the nice part, I really like doing farm calls and going out to people's places because I can look around and bring my ideas and creativity, or I know what Joe is doing up the road. And when I tell Bill that, two sections away, I can say, hey, this is something that worked for somebody else nearby. And sometimes those ideas, oh yeah, that's a good idea. Let's do that. And I think that really helps people help their horses and keep things nice. So I kind of like doing the farm calls, even though we do a lot of haul-in work. But yeah, just educate. But those are the two big ones, the older horses and the colics for sure.
Yeah, I think probably a nice thing about doing farm calls is you can sort of observe the horse's living situation and maybe make recommendations to the owner based on what you see when you're actually at their farm. So I'm sure that's pretty helpful as well.
Exactly. Yes.
And the old horse thing is such a big topic. I never even realized until I moved to a northern state, how intense winters can be and how proactive you have to be about, your horse's welfare, if they're going to be able to walk on the frozen ground, if they're going to be able to maintain their weight, what's going to happen if they need to be euthanized in the middle of the winter when the ground's frozen. So it's such an important topic to consider if you live in one of these harsh weather states.
For sure. I think it's interesting, Carly. A couple years ago, I was looking at the laws for shelter, and there are 48 states that require shelter for horses. Many states stipulate that trees are adequate shelter. Some states say it has to be this size tree or this many trees or whatever it is. But the two states that at that time, and I think this is still true because I'm not aware of any changes, the two states that did not have shelter laws for horses were Montana and Alaska.
Wow.
Which is crazy to think about, but it just kind of goes to show you that really horses, they are cold adapted and they can do fine in the winter as long as they're baseline healthy to begin with. It's the ones that are not, those older horses, those horses really can suffer. So the healthy horses somehow manage and do fine. It's these other horses that we really need to pay attention to and advocate for.
Yeah, well, I think this has been really great advice for anyone who's practicing in a state where it gets cold, either consistently or maybe a couple of times throughout the winter. So thank you so much, Dr. Boswell, for joining us again on the podcast. I always love to hear your perspective. And thanks to our audience for listening. Oh, no, you're good. Thank you so much to our audience for listening. And a very special thank you to our sponsor, Merck Animal Health, for continuing to support the podcast. If you have any questions or suggestions, please send me an email at csisson@equinenetwork.com.